Gold participants from around the world. I'm Fleur Bickford, Program Director and MC for Gold Conferences International. And I'm here today talking with Dr. Kathleen Kendall Tackett about her upcoming presentation titled Mother-Infant Sleep Location. It's not as simple as it seems. Welcome, Kathy. It's great to have you with us today.
Thanks, Fleur. I'm happy to be here.
So just a couple of questions for you, just to give our delegates a little bit of an idea about your presentation. And the first question I have for you is, what do you think is the biggest challenge these days when it comes to safe infant sleep messaging?
Well, I think actually, honestly, we've been making a huge mistake, and I say we kind of as the sort of healthcare field, in that we think that, we give a, quote, simple message, and that's going to kind of do the job. And really, the evidence does not support that. That if you just tell people don't sleep with your baby, that they're going to do it. One of the things I actually got really concerned about several years ago, and it's one of the reasons why we did the study, is I started having mothers tell me, okay, they weren't bed sharing, but they were going out with their babies and sleeping on the couch. And if you know anything about like SIDS risk, that's like off the charts risk. So by our messaging and our, quote, simple messaging, we were actually encouraging a much more dangerous behavior. And so that was one of the things that kind of, brought me into looking at mother-infant sleep. And as a health psychologist, I'm very interested in sleep anyway, just because it's such a key variable in terms of, well-being. And so, again, mother-infant sleep, really, it's interesting not only in terms of where the baby is sleeping, but, how it's impacting the mother's mental health, how it's kind of helping her cope. So these are things I also wanted to look at. It's one of the reasons why we asked all the trauma questions, because, again, like I said, you can't ask about sleep, and, since trauma and depression both have a huge impact on it. I wanted to make sure we kind of covered that. But yeah, the mother-infant sleep location is a really, really interesting thing. And one of the things we kind of learned early on is that most people don't really tell you the truth. And I kind of suspected that that was going to be the case. It depends how you ask the question. When we asked people, where does your baby usually sleep, only about 30% said the baby was bed sharing. Okay, and when we asked, where does your baby end the night, that number jumped up to 60%. So right there it's telling you that, that mother-infant sleep location is not kind of a static thing. And anybody who goes into homes and works with moms can tell you this. Babies sometimes may start in the crib, but they don't necessarily end up there. And so we need to make sure our messaging is including all of these complexities. And we found actually lots of demographic kind of differences. And so again, like I said, to think we can have a same message for everybody is kind of ludicrous. It's a much more complicated behavior, and we need to really make our messaging appropriate to that, and we need to do it in a way that respects parents. No matter how much we keep telling them not to do it, they're still doing it. Okay, and so that's something we need to be thinking about in terms of, okay, acknowledging that reality and then working from there and saying, okay, so how can we make sure that this is, being done in the safest way possible? And so again, like I said, really what I would say is we need to move away from the, quote, simple message. It's not working. And it's not working because it's not really acknowledging what's going on with mother.
Hey, thank you. And it's definitely interesting. I certainly find in my own practice that, I get that all the time, that, parents are bed sharing. Often they don't want to admit it because they've been told that, they shouldn't. And it is definitely a very complicated situation. So definitely lots of complexities there. Okay. The other question I have for you is, what has surprised you the most during your research into infant sleep?
Well, it's kind of funny because, the thing that's interesting about doing the study is how many times I've been surprised. I kind of came into, looking at mother-infant sleep with some ideas about what we would find. And I continue to get surprised. And that's actually kind of a nice thing because, I love it when the research can teach us something new. And I kind of feel like with some of our data, we're moving into some kind of new territory. Like one of the things that I'll, talk about in this presentation is I'll talk about some of the demographic factors. And they kept surprising me. I was sitting there literally running the data analysis going, wow, really? So, I kind of had this idea that it was kind of mostly sort of, educated middle-class women who were more likely to be bed sharing. It's not true. It's actually, you find the less education they have, the more likely they are to bed share. They're more likely to bed share if they're single or separated. Actually, we found a huge number. And honestly, that kind of makes sense if you think about the stress of separation, that it makes sense that everybody kind of want to be together at night. But the other thing that we kind of looked at in this is I looked at, sleep location by feeding method. Because I've got people who say, oh, well, people who are bed sharing, and there was a study that just came out about that. And the people who are bed sharing have, more anxiety, less bonding, and it's kind of like, well, did you talk about how they're feeding their baby? Because you know what, we're finding that makes a difference. If you are especially exclusively formula feeding and bed sharing, that actually tends to be much more stressful than actually having your baby in bed if you're breastfeeding. So we found that makes a difference. So, there hasn't actually just been one thing that surprised me. It's been a continual surprise. I was actually really surprised that a lot of the families with bed sharing also had their pets in the bed. And again, like I said, those are the kind of conversations we need to be having with parents, because honestly, I don't think that's a good idea. As much as I love my animals, sleeping with a baby in the bed, I don't think is probably a safe thing to do. So again, you find it was like 50%. It was a really high percentage. More likely to have other children in the bed. I mean, it was just, there's just been constantly interesting things around the corner. I think part of it, too, is it's nice we have a big sample. We have a sample from 59 different countries. So I feel like we're getting a really pretty good snapshot of kind of how mothers...
Hey, thank you, Kathy. That's fascinating. And it sounds like, in your research, you've been asking some different questions that don't normally get asked. And sounds like it's got lots of interesting research there. So really excited to see your presentation. And for our delegates who are listening, who are interested in hearing more about the research and all of these facts and results that Kathy's been talking about, you can hear her presentation as part of the infant sleep add-on package for the Gold Lactation Conference. So that is available in conjunction with the main conference. And Kathy, really looking forward to watching your presentation. Thank you for joining us today.
Oh, thank you, Flora. I enjoyed being here.